you did PT, you showed up, you did your exercises, and it still didn't work. Maybe you're even worse than when you started, or maybe it got a little bit better, but after all of these weeks, your pain is still there. And now you're wondering, did I not try hard enough, or is physical therapy is just not it, like everybody says? Here's the truth that I want to tell you. Physical therapy did not fail you, but the current system did. And I want to tell you why. Look, I'm a physical therapist. I have worked in and out of traditional physical therapy clinic, and I'm not going to sugarcoat it. The way people experience physical therapy here is broken. I think we can say that the entire medical system is tailored for sick care instead of healthcare. We are more reactive than proactive. You walk into a clinic, you get 30 minutes with a physical therapist, and then you got handed off to a tech who is not trained to see your movement pattern, to adjust your program, and etc. And you just paid for this 60 minutes and 30 minutes of somebody just watching you exercise with no accurate feedback. Then you're told to come back 1 to 2 times a week for 6 weeks or 8 weeks, because that's what insurance says you're approved for, which is a crazy idea to me. But then here is my biggest problem. You come in to the clinic and you got a list of all of these exercises, but nobody really told you why you're having pain in the first place, explain to you why these exercises are necessary, and no one was able to give you a clear plan to get you from where you are currently injured and in pain to return you to prior level of function or get you to whatever physical goals that you have. And no one actually sticks around long enough to make a lasting changes for you. So yeah, you did everything right, but it still didn't work. And here are the 5 most common. Reason number 1, they didn't find the root cause, and they never treated the root cause. Most PT clinic treat your pain and injury as a tissue problem. So when your back hurt, they treat your back. When your knees hurt, they treat your knees. When your shoulders hurt, they treat your shoulders. But what they don't realize is that it's more than just a tissue problem, especially if you're dealing with chronic type of pain. It is a behavioral pattern problem. We can treat your shoulders all day, but if we never really figure out why you've been moving the way you're moving and never really fix that problem, then the pain is going to come back when you start returning to your old activities, your old movement patterns. Your pain didn't just appear out of nowhere. It's the result of months, of maybe years, moving in the same pattern, in the same way that your body just one day decided to, like, I'm done. I can't do it anymore. And then it starts being aggravated with everything that you do. Maybe you sit at the desk for 10 hours a day because of the nature of your job, and then jump right into a hard workout without any transition. Or maybe you're the type of person who's always moving, who's always stressed, who's always on alert and never giving your body a chance to recover. Or you have been compensating for so long for one injury that happened years ago, but then all the compensated joints now have been overworked for so long, and they have decided that they're hurting and they don't want to work anymore. So, like I said, traditional PT treats your symptoms or treats what is in pain right now, but they never really address the underlying pattern that put the pain and injuries there in the first place. So when you leave PT, go back to your life, you go back to the same pattern, and guess what? The pain comes back. Because, again, the root cause was not addressed. Reason number 2, no clear path to get you back to your prior level of function or get you back to your goals. Now, in PT school, we were taught as a part of patient interview is to ask what your goals are with physical therapy. But from what I've seen in the clinic, clinicians don't treat your goals as the top tier priority when it should be the beacon leading your reasoning for the programming. Usually they just give you the same exercises as they give anybody else with shoulder pain, or the same exercises with the people that have the same type of back pain or hip pain. But the individualized part of the programming is to take your goals into consideration, your lifestyle into consideration, and your habits into consideration. And if your clinician is not doing that, that is a huge missing piece. Commonly, a lot of the exercises are pulled from what we call protocols. When you have a rotator cuff tear, there is a protocol for rotator cuff tear, and I think that is a great start. I believe in those. They are the basics and the foundations to get you to start moving and out of pain. They are important, but they're not the only things that you should be doing. You should start with those. But imagine all of the exercises that you do in the clinic, banded, light weights, all of these things. But then you want to return to throwing baseball, hitting a volleyball, shooting a basketball, whatever it is. If you're not being properly reintroduced to these activities, there is a huge gap in the middle that nobody is addressing. That's why after working with physical therapy and you're feeling better and all of that stuff, and as soon as you get back to your normal activities, the pain comes back. So did physical therapy not work, or the work just has not finished because nobody really provided you a clear path from where you are right now to where you want to be and actually address everything on that continuum? That is the big problem. And I would say that is one of the biggest gaps, if not the biggest, in physical therapy currently. So after 6 weeks or 8 weeks of being in physical therapy consistently, doing your homework, and then your clinician say that, oh, you're ready to be graduated, congratulations, now your pain is 0 to 2 out of 10, that's perfect. Then as soon as you start playing sports again or returning to your lifestyle before, you're doing things too much, too fast for your tissue to catch up. And now the pain flares up again. Do you see the missing gap that I'm addressing? That is the missing piece that every clinician should be addressing for you. But it looks like you all have been left to figure it out on your own. That's not your job. We were trained to do that. So we, as a system, failed you. Okay, reason number 3, rushed visits and no real attention. I think you and I can agree with this, right? In a traditional physical therapy, you know that when you come in, you pay that copay for the visit, and then you would see your physical therapist for maybe 30 minutes max. And then most of that time, your physical therapist is manually working on your tissue. Now, from my point of view on manual therapy, they have their time in place. They can work temporarily to give you relief, and then that gives you enough wiggle room to push you to start moving. And that's the important part of manual therapy. But is it necessary? I would like to argue no. They should not be the reason that's making you feel better. Because if you have to rely on me to feel better, I have failed you as the clinician. You have to put in the work. You have to be consistent in order to change from the... Now, going back to the rush visit and no real attention, your therapist is usually juggling between 2 to 3 patients, and then documentations, and then making sure that we're billing the insurance correctly because we don't want to get denied. And then your exercises in the corner, hoping that somebody is checking in on you, or you do have a tech that is talking to you but not really providing any good feedback regarding your movements. Here's the thing about movements though. Movement is nuanced in terms of one single movement can look very different across body types. How you're built anatomically, a squat can look very different for you compared to Joe over there. This is a big thing. Compensations are so subtle. You might think that you're doing a squat correctly, but you didn't notice your knees are moving a little bit more than I like them to, or your pelvis moves a little bit too much throughout the entire range of motion, or your neck is cranking all the way up, or you're not bracing enough. All of those things can be missed if your clinician is not watching you the entire time. And those little things, they matter. They matter in the most foundational level. They're the difference between building resilient movement patterns and reinforcing the same dysfunctional movement patterns that had led you here. Avoiding movements, hating your inability to participate in your sports, training, lifting, whatever it is that you've been wanting, dying to do. So in a busy clinic with packed schedule, there's no time for that level of details. And details is important. As a clinician myself, I need to see your movement from every single angle as one. And I need to see you performing in your natural environment. That means your own gym or at home or wherever that you're performing these movements and not just in the clinic. Reason number 5, you got graduated too early. Now, I'm going to tie this reasoning back to the second reason regarding no clear path and no addressing gaps between your time in the clinic and where you want to returning to sports, returning to life, returning to whatever activities that you want to do. Now, you've been in the clinic doing all these banded exercises and all these tiny weights. You have no more pain. And they say that you're ready to go back to your life. But the work isn't done. If your normal level of function is you deadlifting 600 pounds, you deadlifting 225 pounds in my clinic pain-free does not mean you're ready to return to your normal function. No, this gap is where people re-injure. This gap is when people start doing too much too fast because nobody is telling them that they can't do that, or else their pain will flare up again. So again, the work is not done. You need continuous graded exposure to get you back to that 600-pound deadlift or whatever it is activity that you want to return to. If you are not able to get even close to 80 and 90% of your capacity, then I will not be confident to return you to the wild, because you're gonna end up back in my clinic in, 3 to 6 months. Now, sometimes it's also not up to a clinician either, because even if they think that you're not ready to return to your prior level of function or your activities, insurance has a big say in how many sessions that you get. So a lot of time, the plan of care is not completed, but clinicians in traditional physical therapy clinics don't have the freedom to say that we can continue, because insurance say, well, good luck, we're not going to pay for the rest of whatever session that you think that they need, which is a crazy concept to me. Clinicians have gone through school, through rotations, have gotten all of these education to make the correct plan of care for the patients, but for-profit insurance companies have the end saying in the patient's plan of care. Crazy to me. Anyway, I saved the biggest reason for last, because this concept is one of the most important things I want people to understand, whether you have pain or not. Reason number 5, if physical therapy did not work for you, is because you only reduced your load. You didn't build up the capacity. Let me explain. I want to introduce you to the concept of load capacity. Now, load is what you want your body to do. So you want to be able to hit 600-pound deadlift, or you want to be able to do a marathon, right? So that's the load, that's the intensity that you want your body to match. Now, the capacity is what your body is able to handle right now, okay? So once you increase the load, you expect the capacity to also come up to meet that performance. Pain happens when load excessively exceeds capacity. Now, here's what most people do when they're in pain or injured. This is where you're at. You reduce your load to match your capacity by resting, stretching, taking a break from the gym or from training, getting a massage, yada, yada, yada. Those treatments can be helpful, And yes, you will notice your pain gets better because load and capacity match, right? And as soon as you start feeling better, you're like, okay, I'm ready to go back to the gym or go back to the court and do whatever that you usually do. And then you're like, what does that hurt again? It's not working. What do I do? But then you don't realize the gap that we just talked about. You can't just jump from here back to here. We're not addressing that. All of those things that you did helped temporarily, but you never address the main problem, the low capacity. You have to build capacity. You need to train your body to be able to handle the load correctly, appropriately, progressively, okay? That's what actually creates lasting change when it comes to physical therapy or regular performance or just strength training in general. Now, strength training is rehab. Strategic, graded exposure to load over time. In traditional physical therapy, they're most likely not addressing that at all for you just because they don't have time. Insurance says no. And then two, the problem with traditional physical therapy is that they put themselves in a separate bucket from performance training, when physical therapy should be all the way up there. You know what I mean? Food for thought. Because if we're not doing it, who's filling in the gap between pain and prior level of function? That's our job. Anyway, here's what I believe, and I know this to be true. Physical therapy works, but the way that you and many others are experiencing PT is fundamentally broken. I don't know if I say broken or flawed or inadequate. You need a good exercise program. Yes, that is a given, but you need education on what happened to your body, what is going to happen to your body, and why these exercises were selected. What can you do from now on, and how can you do it, and how can you do it in a way that create a lasting change? You need a plan. You need somebody to look at the entire picture. You, a person as well, not just your tissue, but also your habits, your lifestyle, your goals. You need ongoing support, daily check-in, real-time and thorough feedback on your movements. I think that is the most imperative thing. Like when I look at my clients' movement videos, I don't skip one rep, none. Even if it's like 3 sets of 10, I watch the entire 3 sets of 10 because I want to see how the reps look like. I want to see if there's any compensation on any reps at all so that I can make them aware of it. You need someone who is flexible with your programming to adjust your program when you have flares up according to how your body reacts to it, or when life gets busy for you, or when you're traveling, because work don't stop when you're traveling, okay? And you need to stay in care long to actually make the changes stick. If this sounds familiar and you've tried traditional physical therapy and it didn't work for you, that you're still in pain, still frustrated, still wondering what you're doing wrong, I desperately want you to know that you don't have to live in pain. Pain is common. Chronic pain is common, but it's not normal. And it is definitely not something that you have to come to terms with living with for the rest of your life. I want you to know that you're not broken, but the system that's trying to help you is broken. And if you enjoy and got something out of this video, please like and share all the YouTube stuff you know how to do. And I will see you in the next video.